So I would like to first to ask for your permission to use this for educational purpose and possibly even on internet. Now, I go around and I'm putting lots of emphasis on training surgeon. And I know that the technology make many things easier, and as well in the spine there is a surgical robot that people are talking about using it more or less. But you have experience with robots. Tell me about your experience with robots.
Well, in 2008, I had prostate cancer.
Okay.
And I was living in Naples, Florida at the time. And they had a surgical center there at Naples Community Hospital when two doctors had invested in a Da Vinci robot for their hospital.
Mm-hmm.
And they went and got trained, but they did about approximately 300 surgeries, and they were going real well. But then, unfortunately, the day I had my surgery, 3 people had ended up with problems where blood vessels and intestines were cut. One woman had a bladder operation, and she almost bled to death and had problems afterwards. Well, they sent me home with one of my incisions on my right side. When I left the hospital, I kept telling them, I have so much pain inside. I have so much pain. Can you give me something? The floor nurse accused me of just drug seeking.
Mm-hmm.
And when I showed her the incision where it was bleeding, she says, well, just put a bigger Band-Aid on it. You're drug seeking, and I'm going to send you home.
But you said they found the problem. What was the problem?
Well, when they sent me home the next day, every time I'd get up to walk, I'd feel dizzy and want to fall down. Well, then the swelling started in the stomach and the growing area.
So you had the bleeding going on inside.
And I was bleeding inside.
Wow.
And when I called the nurse in charge back and told her I've still got blood, she says, put another Band-Aid on it, you'll be okay. Well, the next day I went to take a shower, and I was in the shower, and all of a sudden I fell down, and I couldn't get up, and I went into seizure. And I lost my bladder, and I had a bowel movement in there, and managed to crawl back to bed. And my wife called 911, and they came, and the EMTs got me out into the ambulance. And the one said, I'll take care of you, buddy. We'll get you to the hospital. So he put some saline or something in my arm just to keep me going. Well, they got me into the hospital, and they put, I believe it was 7 to 9 pints of blood back into me to get me normal, and put in the catheter and all that stuff. The doctors, the surgeons were gone. So they kept me and tried to get me stable, but they couldn't get me stabilized even with the blood. I kept losing blood. On the second day at 6:30 in the morning, when shift changed with the nurses, I was sharing a room with a guy named Johnny. I said, Johnny, I feel like I got to go to the bathroom. And as I was getting up, he said, look at your bladder, or look at your catheter bag. The catheter bag was blown up to the size of a volleyball, and there was so much blood in it. Well, my urologist happened to be there that morning, and Johnny was there, and he got on during the shift change and hollered to the nurses that, hey, you better get in here, this guy is dying. I was gone at that time. My heart had stopped.
Yeah.
And
so they cut a blood vessel that the robot...
well, that's what it ended up being.
So what did they find out?
Well, when they went back in, they couldn't find anything. They opened my stomach up, took all my intestines out, and they were looking, and finally they found a cut in the back of my bladder, and I had several cuts in my small intestine, and when they were taking out the prostate, they almost cut my penis in half at that point. And so they had to actually take it at the bottom of the bladder where the penis attached. They had to cut out the sphincter muscle there.
Okay.
And to this day, I have incontinent problems with lifting or anything like that.
They found a technical problem, correct? You told me they found a technical problem.
Well, when I did more research, the doctors didn't admit on this, but I did some research. I went online and I talked with other people that had the same problems. And I went online and the University of Toronto was actually where I found there was a doctor there who explained what was going on with the Invasive robot. And it was the fact that the negative cable that goes in they had some bad ones that had hairline cracks in them. So when they were doing the surgery and doing the cutting with the other, where the positive comes back from the negative, well, sometimes it would jump through where the hairline crack was, and it'd go through. In my case, it went through blood vessel and 8 spots in my small intestine, and cut around my penis, around where the bladder is attached to the penis.
So it
So
was a
bad that
technical
they had to
problem of the
actually,
machine. Okay.
yeah, malfunction of the machine. And the recommendation of the University at Toronto was that these should not be used for doing prostate surgery on men, nor should it be used on doing surgeries on women for.
Well, that emphasized that why surgeons should practice more to do that themselves rather than relying on machines. Well, I thank you for sharing this experience. Okay, I appreciate that.
Yeah, you're welcome.